lawsuits, but there are a couple of things about malpractice that you need to know. One is that actually most of the costs of malpractice are defending the case. The amount of malpractice money that actually goes to people is very small. The people who get a lot of money are the people who have permanent damage and ongoing health care needs. And part of why they get so much money is that part of the settlement is to pay for their medical care for life. And so when you have a system where everybody is in the same system and their medical care is automatically covered, the impetus to sue is down, and actually, I can't remember what countries it is, but they've done studies about this where malpractice suits go down, and you're able to compensate people for injury because it's distributed fairly and it's part of your accountability as a system, not just, you know, oiling the squeaky wheel. And so it indirectly affects malpractice. The other thing is that it also, a lot of times malpractice is a systems issue. It's not really that one person did something wrong. There's like a bunch of steps that happen. And there are, and I don't know the name of the article, but there are interesting articles in terms of what's happened, for example, with hospital-acquired infections when they instituted checklists in hospitals, or wrong site surgery. Very basic things, and they learned this from looking at air traffic controllers and pilots. And doctors hate that because we think we know exactly what to do, and you know, we're God, we don't need a list. But good data on when you do that, you get better outcomes. And so part of the vision would be, because now it's going to be your dollar, you're going to do that. Because if you make that mistake, it's your dollar that you're spending to make that person healthier. So your incentive is in the right direction. So that's in terms of malpractice. End-of-life care. My husband wants me to carry a bill about end-of-life care next year. And I told him I really can't, because I can't be health care reform and death panels. It just doesn't work. And so I suggested to him we have a Senator Guzman, who's a minister. I said she might be better for that than me, you know. But you know, one of the things about end-of-life care is that the truth of the matter is that if you're not paying for that person to be kept alive day after day after day, you of course want them to be kept alive forever. You're never going to say give up, right? So what Texas did, and I'm told Texas is a pretty conservative state, is they passed this law that said if two independent doctors agree that your care is futile, they can stop your care. And they can't, like they have to run it by a board of ethics, and the board of ethics has to agree that your care can be discontinued. And it takes it away from the patient's family having to make that decision, and it makes it a medical decision. I think it's called the Texas End-of-Life Care Act or something. And he wants us to do that in Colorado, and I told him I wasn't touching it with a 20-foot pole, but go for it. So you're right, and the reason it's not specifically talked about is there is way too much emotion around how do you deal with end of life. Now, ideally, in that patient-centered medical home where you feel we know your whole life inside and out, or a partner with you in your health, you're having those conversations about how do you envision your life ending. I like to tell this joke that some of you may have already heard, that I used to say there are two things you can count on, death and taxes. I've since learned that you can get out of taxes, but as far as I know, you can't get out of death. So we do need to talk about that and how we get to that moment in our lives. And interestingly, I think so many people are seeing people kept alive beyond what they think is humane, that it's going to be more of a conversation that people are willing to have. I think
there's a whole lot more of us that are getting to the age where we're worried about that.
Right, exactly. And being willing to talk about it proactively so that you don't leave that burden on your family to have to be part of that decision.